a warm welcome here from our studios in Sarakunda. This is the Star TV News and I'm Ajakare Sanyang. In the headlines tonight, Front Star Housing donates a stage to Star TV FM in their fight against the pandemic. Lamin VDC in collaboration with Boka Halat Women Society of Lamin Wayoto supplies Lamin village with sanitary materials. Gambia Health Minister confirms 4th case of COVID-19 as his ministry battles to stop the spread of the virus. People continue to enter the Gambia illegally despite Gambian government authorizing the closure of all borders. Gambia government to come up with measures to mitigate the plight of public drivers in the fight against COVID-19. On the international scene, polls close in Mali amid coronavirus threat, security fears. Trump extends U.S. social distances until April 30th. Cuba sends doctors worldwide in coronavirus fight. Those were the headlines and now the news in detail. Over the weekend, Front Star Housing have donated $50,000 to Star FM TV in one of their radio talk shows, Wake Up Gambia, in which they were seeking pledges on behalf of the needy in order to provide the community with preventive materials needed to protect themselves from the deadly coronavirus. Binta Koli files in this report.
Speaking at the presentation ceremony, Modulamin Baji, CEO of Front Star, said Front Star is a Gambian-owned company and they will do everything in their capacity to come to the aid of Gambian people, which is one of the main reasons why they made this donation.
Company that is owned by a Gambian, and then we've been trying to advocate this for these few months, that we are here for the Gambian people. We are not here for our interests alone. If you look at the company, all the staff here, they are all young and they are all Gambians. And look at our service too, they are all affordable. So within that we have this virus or disease that came in the country, and then it's a virus that which is a deadly disease. Yes. And I think that everyone knows that. So we take it deeply upon us that we should fight this thing out. If people are coming to patronize you and there is an emergency, I think you should take something from your profit and then invest it back to your nation. And then I've seen companies here who are better than us, bigger than Front Star, but then I haven't seen most of them coming out. I think Front Star is the first to come out and start supporting, and since last week. And then we are still continuing. Because since this disease started, since the first case we had in the country, we all know that business is not going normal. But Front Star say whether business is going or not going, I think it is our responsibility to fight it out.
According to Mr. Baji, Front Star have chosen to partner with Star FM Slice TV because they have Gambia at heart and are always ready to support and render their services to the Gambian community. He promised they will continue to partner with Star FM Slice TV.
I promise Front Star will never fail Star FM. And I know Star FM will never partner with any company that doesn't put Gambia at heart. I think this is the reason why Star FM thought that it is necessary for them to partner with Front Star and then move together. This pledge we've made, to us, is just a token, because this is what we can afford, because we've been doing it not only at Star FM, but at different places. But then when this initiative come, we know what Star FM can do. They've been there for the Gambian people well before Front Star is born. So that's why we want to join Front Star, Star FM, and then continue the good work they are doing. We've seen many radio stations and many TVs, but I think if you want to partner, you have to screen and know, and then know the ones you should partner with. I'm promising Star FM, the managing director, the CEO, and the entire staff that Front Star will continue to partner with you guys and work for the better of this this great country.
Usman took the opportunity by thanking all his staff, saying they all put in a lot of effort to see that the company move forward. Also in attendance was the managing director of Star FM/TV, Sarah Kamara, who thanked Frontstar Housing Estate for making their pledge through his noble company. He also gave a brief explanation of how pledges started on the radio.
Recall recently, due to the COVID-19, we run a donation program on our radio, on the Wake Up program that is sponsored by Frontstar. And then people were making in pledges, and then happily for us, Frontstar call in and then make pledge, and then the pledge that Frontstar made is one of the highest pledge that they made so far. So we are very, very happy for that. And then we also want to say a big thank you to Frontstar, because we've seen the partnership that since Frontstar started having programs with us, advertising with us, and then sponsoring, some of our major programs. We've seen the improvement that has happened between the two institutions. So we are very, very happy for that. And then this partnership, we all know, is going for a long way.
Mr. Kamara added, since the outbreak of the pandemic, many people have been going through a lot of difficulties, and having things to protect themselves will have a great impact in their life, especially the people in the provinces. He also appealed to other companies to emulate from Frontstar Housing Estate.
We are aware of so many people who are in desperate need, of these sanitary materials that they should use, especially in the upcountry. A lot of them call Star FM, Star TV, that they are in desperate need of these things, and then it is not forthcoming to them. So we say it is necessary for us to also raise funds so that we can reach out to them. At least we will be able to help save them, because this fight is not only government. All of us has to come together and then collaborate, because at the end of the day we are all vulnerable. So we say a big thank you to Frontstar, not only at Star FM. We've also seen you've also done a lot. All right, since the outbreak of this virus in this country, you've also contributed in a lot. So we want to say a big thank you. If all companies were like Frontstar, at least I would say we will win the fight against the coronavirus easily. So I'm calling on other companies also to emulate the footstep that Frontstar has already taken.
Frontstar Housing Estate is a Gambian company operating in the Gambia, making homes and houses affordable and comfortable for every Gambian residing in the Gambia and abroad. For Star TV News, I am Binta Koli.
The Lamin Village Development Committee, in partnership with UK-based chapter of the Lamin VDC and the Boka Halad Women's Society of Lamin Wayoto West Zone, launched hand-washing strategy in the village through supply of sanitary equipment in the fight against COVID-19. Maya Madam was there, and she files in this report.
As part of the global campaign to fight the spread of COVID-19 pandemic in the world, Lamin VDC distributed sanitary items to the village, as well sensitized the people on the preventive measures and spread of the pandemic. Jamme Ike Bojang, the VDC chairman, shows gratitude and thanked the VDC for their initiative in fighting coronavirus.
I want to say thank you so much for this great initiative. We have to thank ourselves, because we are fighting for ourselves. We are defending our community against this terrible virus. And we need to thank ourselves for taking any initiative, this one in particular, to save lives. I want to thank the press for being here. You are a worthy partner to this great fight.
Lamin Esdrame, the PRO of the Neighborhood Youth Association, explains the reason for launching this strategy and thanked the donors for their support in fighting the virus.
How to fight against this deadly virus called coronavirus or pandemic. So we can't do it alone, so we have to join hands. That's the reason why we're here. So I want to take this opportunity to also to thank the UK-based, Lamin Group, who have facilitated all these things, these hand sanitizers and then the buckets to help us in fighting this virus, and then the elders also, and then all the concerned citizens. So I want to say thank you very much, and then also to my fellow neighborhood association members.
The Lemon Village Alcalo also thanked the donors and promised to put the equipment in use. Maria Madem, reporting for Star TV News.
Health Minister Dr. Ahmadou Lamin Samate on Sunday confirmed a fourth case of the pandemic coronavirus in the Gambia. The infected person was said to be in his 50s, came into the country from France through Royal Air Maroc flight number H579 on the 15th of March 2020. Jacqueline Coley has more on the story.
Honorable Samate said the infected person came into the country on the same flight as the first case, even though they originally departed from different countries.
This issue was reported to the Rapid Response Team through the National COVID-19 Hotline 1025, being operated by the Ministry of Health. A sample was collected from him and the positive test result came out on the night of the 28th March 2020.
He added that 16 of the victims' close contacts have been placed under quarantine and plans are on the way to have their samples tested for coronavirus. The minister said there is a new probable case that has been reported.
We have a new probable case that has been reported as the laboratory results of one of the contacts recently came out inconclusive. So that is the probable case we are talking about. A repeat sample from the probable case would be taken and tested in a couple of days to conclusively determine whether it would be COVID-19 or not.
The minister appealed to all contacts to call the toll-free number 1025 for advice as to protect their families and the general public.
The Ministry of Health appeals to the general public to remain calm and vigilant and follow the preventive measures at all times. The Ministry also appeals to the general public to follow the executive directives issued by His Excellency the President to stay at home.
Jacqueline Coley, reporting for Star TV News.
Almost weeks after the Gambia closed all borders as part of measures to stop the spread of the coronavirus, people continue to enter the country illegally by land and sea. Authorities have apprehended 3 Senegalese who entered the country illegally on Sunday. Jacqueline Coley reports.
On Sunday, 29th of March 2020, between 1500 hours to 1600 hours, 3 Senegalese nationals were apprehended on the Bakau Riverside in the Kanifing municipality. The 3 youngsters, 22, 17 and 10 years of age, agreed to have come from Senegal but argued to be fishermen from Bour on a fishing expedition and not running away from the coronavirus. The police in Bakau contacted the immigration and health official to perform the required action. The 3 are currently in one of the COVID-19 quarantine center. Star TV talked to authorities of the Gambia Fire and Rescue Services, who confirmed that their office was informed of the news and they contacted the Bakau police and 1025 for intervention.
So yesterday we apprehended a fishing boat that came from Senegal around 2 p.m. Then upon receiving the information, we immediately rushed at the area where they landed. Then we escorted the 3 fishermen up to our office. Upon arrival in our office, we later called the 1025 emergency number, COVID, and to inform them about those people. Later on, they arrived and took them along for further screening and testing. It is for them to continue working together with the security, because as we know, the security alone cannot do the whole job. So we need the support of the community. Whenever they get or they see someone coming from another country or some in here, they have to go and inform the security so that they can take the appropriate measure in order to protect our nation.
Our investigation further unveiled that both the Bakau Police and the Fire and Rescue Services are not fully equipped with personal protective equipment, clothing or equipment designed to protect them from physical hazards when on such operations, and also lack the capacity to fully monitor the seasides. According to the Gambia's government information, the 21 days lockdown was a decision taken after consultations between the Gambian and Senegalese governments. Therefore, essential services such as movements of security and medical personnel and transportation of food and medical supplies between the 2 countries will not be affected. Jacqueline Coley, reporting for Star TV News.
The permanent secretary of the Ministry of Works, Transports and Infrastructure, in an exclusive interview with Star TV, revealed that his ministry is working with the government in order to come up with measures to help the drivers. These measures are part of the ministry's efforts in the fight against the coronavirus pandemic, especially in the area of public transport. Model Baji was there and he now reports.
The Permanent Secretary, Minister of Work, Transport and Infrastructure, Modu KCC, indicated that the government of the Gambia is currently working on plans to help the public drivers on their areas of earning, either by reducing the price of fuel for the drivers or to look into other means which will be suitable for the drivers. PSCC added that there are 2 billion economic projects. He also urged the general public to abide by the WHO guidelines in battling the COVID-19. The president of the Gambia Transport Union, Omar Cisse, indicated that drivers should know that this is a moment of sacrifice, not struggling to get money as it used to be. Cisse noted that some drivers have increased the transport fare. However, Mr. Cisse noted that drivers should adhere to the government's policy in mitigating the spread of the COVID-19. Cisse added that all these fares are currently frozen and drivers to stick on those prices. Reporting for Star TV, I am Modo Elbaji.
And now news beyond our borders. Polls have closed in Mali's long-delayed parliamentary elections, marred by gunmen abducting observers in a bid to stop the vote. Turnout was low due to security concerns and fears over the coronavirus. The election had been postponed twice previously because of violence by armed groups, but it went ahead this time despite the kidnapping of opposition leader Soumaïla Cissé. Al Jazeera's Nicholas Haig reports.
Empty polling stations for an election meant to bring peace to Mali. Many voters chose to stay home after attacks by armed groups and the risk of coronavirus. But Batoma Dembele says she won't let those threats shut her voice out.
I have hope in these elections. The MPs must not forget they are here to represent us and not to fill their pockets with money, but to serve our needs.
An end to the violence is what Malians want. This is the village of Ugosago, which was attacked once again in February. In the past year, nearly 200 ethnic Fulanis have been killed by their neighbors from the Dogon tribe. Human Rights Watch says both the UN peacekeeping troops and Malian forces could have prevented the killings.
Stopping this cascade of violence is incredibly important because it is, of course, deepening the security crisis in Mali by pushing more and more young men from all different ethnic groups into armed actors, which is just leading to this exponential rise in violence that we're seeing.
In the absence of the state, an armed group called Jamaat Nusrat ul Islam wal Muslimin is stepping in, offering protection to the population. The Al-Qaeda-linked group says it's willing to negotiate a peace agreement with the government. But it's first demanding the departure of 15,000 French and UN peacekeeping soldiers and the parliamentary elections be cancelled. Days before the vote, the government says the armed group kidnapped Mali's opposition leader Soumaïla Cissé while he was campaigning in Timbuktu. In north and central Mali, fighters often target elected officials. Opposition party candidate Boubou Diallo is an ethnic Fulani. He believes the threats and intimidation should not stop people from voting.
Voters have a lot of expectations. If I am elected, we need to defend the interest of those we represent and of all Malians, including those that feel left out.
Schools have been shut down for nearly a year due to a lack of funding. Health facilities are overrun, understaffed and ill-equipped. A new parliament would allow new budgets to be voted and hold President Ibrahim Boubacar Keïta accountable. Some have accused him of corruption. But with more than 300,000 people displaced from their homes, continuing attacks by armed groups and a curfew imposed to prevent the spread of coronavirus, few have come out to vote, either out of fear or frustration with the political system that has failed to bring peace to Mali. Nicholas Hawk, Al Jazeera.
As the outbreak continues to grow across Europe, leaders and health officials are warning their citizens that antivirus measures could stay in place for months. The UK's Deputy Chief Medical Officer says social distancing rules will be reviewed after 3 weeks, but warned that this period could last for 6 months. In France and Spain, many hospital officials say they are stretched to the limit. Al Jazeera's Paul Brennan reports from Chessington, UK.
A steady procession of hearses bring the latest virus victims to the temporary morgue set up in Madrid's largest ice rink. On Sunday, Spain recorded another daily death toll of more than 830 people. Such a small increase on the previous day is seen as a glimmer of hope, but the situation remains critical.
Dicho esto, sí que es cierto que la epidemia.
It is very likely that the outbreak is evolving properly, thanks to everyone's efforts. Having nearly 20% of our cases recovering is an encouraging statistic. But it is true that the number of people going into intensive care units is still increasing, and there are many regions operating at maximum capacity and many other regions quickly getting closer to this limit.
Y hay ya varias comunidades autónomas.
The UK has recorded its second successive day of more than 200 new deaths, and the government has put the entire country on emergency footing, unprecedented in peacetime. Asked about the timescale for the current restrictions, the answer came it could be many months.
So I think 3 weeks for review, 2 or 3 months to see whether we've really squashed it, but about 3 to 6 months ideally, and lots of uncertainty in that, but then to see at which point we can actually get back to normal. And it is plausible that it could go further than that.
There's been criticism and controversy over the limited scale of the UK's testing regime, but there is evidence that capacity is slowly increasing. This drive-through test centre in the car park of an animal adventure park at Chessington has opened specifically for National Health Service workers. The Royal College of Nursing, Britain's largest nursing union, estimates that up to 20% of the UK's healthcare workforce is currently at home self-isolating. These testing centres will bring certainty, allowing potentially hundreds of nurses to return to the front line of nursing at a time when the healthcare system needs them most. In France, overwhelming pressure on congested hospitals in some regions has made it necessary to transfer patients to other areas. These patients are being taken by train from the Grand Est region to New Aquitaine. And some French patients are being transferred to Germany for treatment by a combination of German military plane and French military helicopter.
We need to free up some space. When you free up a space, it gives you room for a new patient. And that saves a life, so there won't be a gridlock on hospital resources.
Across Europe, coronavirus restrictions have left the streets almost empty. But the grim prediction is that it will get worse before it gets any better. Paul Brennan, Al Jazeera.
US President Donald Trump has extended nationwide social distancing guidelines until April 30th after the country's top infectious disease official Dr. Anthony Fauci said deaths in the United States from the coronavirus could reach 100,000 or more. He had originally wanted to get businesses in the country up and running by mid-April. Cases in the US have reached nearly 150,000. Trump also implied that piffering was the reason masks were going missing from hospitals. Al Jazeera's Rob Reynolds reports.
Redondo. Empty beaches are a sign of the times in Southern California as most residents follow a statewide stay-at-home order. More than half of the 50 U.S. states are now under those orders intended to slow the spread of coronavirus. The federal government extended until April 30th its guidance that people maintain social distancing. With the number of confirmed cases and deaths rising, one of the country's top infectious disease experts says the final toll could be very high.
Looking at what we're seeing now, I would say between 100 and 200,000 cases, but I don't want to be held to that because it's deaths. I mean, we're going to have millions of cases, but I just don't think that we really need to make a projection when it's such a moving target.
Governors like New York's Andrew Cuomo painted a sobering picture.
I don't see how you get past that curve without seeing thousands of people pass away.
Louisiana is already running short on hospital space.
We're on a trajectory currently to exceed our capacity in the New Orleans area for ventilators by about April the 4th, and all beds available in hospitals by about April the 10th.
Michigan's Detroit Auto Show is canceled, and the convention center where it's usually held will be converted to a field hospital.
We see this astronomical rise. We've got hospitals that are already at capacity.
Illinois' governor said he desperately needs more testing kits.
The White House has promised millions of tests for weeks now, and they're just not here.
In a briefing, President Donald Trump made the shocking and unsubstantiated claim that the shortage of masks and other protective equipment in hospitals may be because nurses and hospital staff are stealing them.
They've been delivering for years 10 to 20,000 masks. Okay, it's a New York hospital, it's packed all the time. How do you go from 10 to 20 to 300,000? 10 to 20,000 masks to 300,000, even though this is different. Something's going on, and you ought to look into it as reporters. Where are the masks going? Are they going out the back door? I don't think it's hoarding. I think it's maybe worse than hoarding.
Earlier, Trump tweeted with evident pride that his daily briefings were getting great television ratings, higher than some popular reality shows. Rob Reynolds, Al Jazeera.
Cuba has over 29,000 medical professionals practicing in 59 countries. It also sends thousands of doctors to work free of charge in low-income countries in Latin America and Africa. Now the island nation is sending medical teams around the globe to help with the coronavirus response. Al Jazeera's Ed Augustin reports from Havana, Cuba.
Another early morning, another ceremony to bid health workers farewell. Last week, a troop of Cuban doctors were dispatched to Italy. This week, medical professionals have been sent throughout the Caribbean, to Suriname, Grenada, Jamaica, and today, St. Kitts and Nevis. 29,000 Cuban doctors and nurses are working in 59 countries around the world, and as confirmed cases of coronavirus increase, so does demand for Cuban medics. Medical services are the island's main export, raising more than $6 billion for the state in 2018. But the communist-ruled island doesn't charge for the thousands of doctors who work in more than a dozen low-income countries in Latin America and Africa. The same goes for disaster relief, where Cuban physicians have provided emergency assistance to millions. Almost 1,000 Cuban doctors arrived in Haiti after the 2010 earthquake, where they were the first to set up medical facilities amid the rubble.
More than 12,000 people were willing to fight Ebola, and right now there are thousands of Cubans willing to complete these missions.
While Western commentators assume Cuba sends doctors mainly to expand influence, experts on the island's health system draw a different conclusion.
The root of it, in addition to Cuba's own health system, which provides universal coverage and universal access, is really the belief that Cuba is one of a number of developing countries that is trying to make life better for its population.
From the moment we're born in this country, we receive an education based on humane principles. The principle of solidarity and internationalism is at the forefront of that. This isn't about politics or ideology, it's about humanity.
You're making a big sacrifice. Why are you willing to go?
Because there are other people that need me, people that are sick and dying, and that isn't right. People shouldn't be dying when there are people who can help them.
Ed Augustin, Al Jazeera, Havana.
And before we end the news, a recap of our main headlines. Front Star Housing donates estate to Star TV FM in their fight against the pandemic. Lamin VDC, in collaboration with Boca Halat Women's Society of Lamin Wayoto, supplies Lamin Village with sanitary materials. Gambia Health Minister confirms 4th case of COVID-19 as his ministry battles to stop the spread of the virus. People continue to enter the Gambia illegally despite Gambian government authorizing the closure of all borders. Gambia government to come up with measures to mitigate the plight of public drivers in the fight against COVID-19. Polls close in Mali amid coronavirus threat, security fears. Trump extends U.S. social distancing until April 30th. Cuba sends doctors worldwide in coronavirus fight. That's all for this edition of the news. Please enjoy the rest of our programs and join us tomorrow for more news. Thank you.